This project is supported by the Administration for Community Living, ACL, U.S. Department of Health and Human Services, HHS, as part of a financial assistance award with 100% funding by the agencies. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by, ACL, HHS, or the U.S. government.
Hello and welcome to Ask SMP. I'm Dunae, your Community Outreach Specialist in Mississippi.
And I'm Janetta, Complex Issues Specialist for the Senior Medicare Patrol Program in Georgia, Louisiana, Mississippi, and Vermont.
Each month, we take a question from a beneficiary and break it down so you can learn how to protect, detect, and report Medicare fraud, errors, and abuse. This month's question comes from Howard, who writes,
I recently attended a panel discussion at my local senior center where someone from law enforcement and a lawyer spoke to us about scams that target seniors. I understand that identity theft happens when someone takes your name and personal information like your social security or Medicare number and uses it without permission. But I'm confused about how this happens and what I can do to protect myself.
That's an excellent question, Howard, and one we hear a lot. Identity theft can happen in many ways: in person, online, through social media, or even by mail and phone.
Right. Scammers may steal your wallet or purse, go through your mail, or even dig through your trash for personal information like bank statements, tax documents, or your Medicare summary notice. That's why shredding personal paperwork before you throw it away is always a good idea. Identity theft can start when someone pretends to be someone you trust. A government agency like Medicare or the Social Security Administration, a family member, or even a computer technician claiming to fix a problem.
And once scammers get your information, they can open new credit cards, drain your accounts, or use your identity to obtain medical care or order supplies you don't need. Sadly, Medicare phone scams are one of the most common ways this happens.
Let's talk specifically about medical identity theft, because this is an area where the Senior Medicare Patrol can really help.
Medical identity theft occurs when someone uses your personal healthcare information, like your Medicare number, Social Security number, or prescription card, to bill Medicare for services or equipment you never received.
Sometimes scammers will call pretending to be from Medicare and say they're sending you a new plastic Medicare card or a card with a chip in it. They'll ask for your Medicare number to verify your identity. But remember, Medicare is not issuing new cards. That's a scam.
Another trick is offering free or low-cost medical equipment in exchange for your Medicare number, like braces, back supports, or genetic testing kits. Once they have your number, they bill Medicare for expensive equipment or tests you never ordered.
Here are a few warning signs that your identity, your medical identity, may have been stolen. You notice unfamiliar charges or services on your Medicare summary notice or explanation of benefits. You receive medical equipment in the mail that you never ordered. A debt collector contacts you about a medical bill you don't recognize. You get a notice saying you've reached your Medicare benefit limit, even though you haven't used any new services.
Those are serious red flags. And once your Medicare number has been compromised, scammers can keep billing under your name until it's reported and stopped.
To protect yourself, never give out your Medicare number to anyone who calls, emails, or texts you unexpectedly. Medicare will never contact you to sell you anything or ask for personal information.
Check your Medicare summary notices and explanation of benefits carefully for errors. If you see something you don't recognize, call your provider or report it to SMP.
Shred all old medical documents, bills, and statements before throwing them away. And if you're shopping for medical supplies online, use trusted vendors, not links from unsolicited ads or emails.
If you think your identity has been stolen, act quickly. Visit identitytheft.gov for recovery steps and a personalized plan.
You can also contact the Federal Trade Commission's Consumer Advice website for resources on how to protect yourself from scammers.
And of course, call the Senior Medicare Patrol right away at 1-877-272-8720 or visit www.stopmedicarefraud.org. We can help you report medical identity theft and prevent future fraud.
Identity theft can happen to anyone, but staying alert and taking small precautions makes a big difference.
Review your Medicare statements, safeguard your information, and never share your number unless you initiated the contact.
Thanks for joining us on this episode of Ask SMP. Stay alert, stay informed, and protect your Medicare.
Take care, and we'll see you next time.